There are more and more underground networks of psychotherapy groups working in the shadows as psychedelics becomes increasingly trendy in the media. Should the medical community discourage these groups, or is there a way to work with them to ensure that therapy is being done in an ethical and proper manner? I struggle with this. We can pretend they aren't operating, but they are, and I feel they can do a great deal of good for many people. I fear the potential for negative outcomes for others.
I can jump in, and this is an area extremely common in the veteran first responder space, and it's huge internationally. I mean, UK, US, Canada. You know, it would be irresponsible for me not to say that, you know, we need to do things the right way. We need to do things responsibly. We need to have the research. We need to go through ethics boards. You know, and I think part of it is there's a couple of reasons for it. One is that anything less of what we're trying to do can be dismissed as placebo effect, as anecdote. You know, a guy went over there and told me he feels better now. We can't discount the people's suffering and how they feel, but to try to get into the mainstream, to get regulatory bodies to accept us, to get medical institutions to accept us, you know, we need to have the literature, we need to have the science, we need to contribute, you know, I mean, subject our studies to peer review to get them into the journals that influence thought. So I just think I mean, I can't sit there and say, you know, I mean, if people are doing it, they're doing it. Please do it safely. Please make sure that, you know, people that have psychosis aren't getting psychedelics. I mean, be responsible doing it. But I think that it's not going to help us as a group to get to where we want to get, which is to have the governments, the regulatory bodies, the FDAs, the Health Canada, the EU, to kind of accept these as mainstream with the same standing as the traditional treatments. So you can tell I've thought about this one a little bit, but you know, and I mean, I really do feel people that are suffering. I got an email from, you know, a veteran in the UK that was suffering, and to say, hang in there, the science is coming soon. I know how difficult that is for me as a clinician to say to somebody, but I just think that if we're in it for the long haul, we need to convince people, and the only way to convince people is with data, ethically done research, irrefutable outcomes, and without that, you know, we're going to just sort of simmer away and disappear for another 20 or 30 years.
I do hope that there's not a dichotomy that develops where there are those who work with the system in the way that Rakesh is describing and do things properly in a regulated way and build the evidence, and then those who you know, sort of reject the system. It would be a shame if it binarizes in that way. There's likely to be a lot of experience and wisdom in those who've been operating outside of the system.
Absolutely.
So my hope is that they, you know, they join and come into the system and put you know, the merits of scientific process to what they're doing. They collect data. They do bother with, you know, certification and such like, and quality standards on medication and such like. That will make for a healthier rollout. Is it going to happen that way? I don't know, but I would hope that it does.
Yeah, Robin kind of touched on the 2 points that I see with that, you know, just sort of framework of you know, getting care to patients is that, one, I think the scalability as these things do move through normal sort of approval process, there's going to be a point where more patients are served by the, you know, the protocols that have gone through FDA, et cetera, you know, similar approval, that'll just be much more scalable at a certain point. That hasn't quite hit that tipping point, but that's definitely a factor. I think that's the, you know, in 5 years, that's the way to get to the most patients with the most efficacy. Secondly, like Robin was mentioning, the issue of the quality of the drugs and what they're actually able to provide, I think is a huge one. I mean, these underground therapists are not compounding pharmacists, they're not drug chemists. And so, you know, I think a lot of times they're getting what they think they can, but there's, you know, all the black market issues with drug quality, purity, adulterants, et cetera. So I think that's a real safety issue that I'm concerned about. And so, you know, I think this is where I see really the ability of the science to accelerate things forward. Like I was mentioning, as an aside to what Ruth was talking about earlier, that there's really a possibility of doing things like breakthrough therapy for some of these more severe conditions sooner. It's not an immediate solution. It's not how can somebody have this next week, but that it might be, shorter than the next few years type thing. And so I really think that those types of solutions playing within the system as aggressively and sort of as fast as possible is the hybrid, sort of middle ground there that gets the most patients, the most access. But there's no perfect solution there. I mean, it'd be best to know everything immediately and be able to immediately provide it to patients, but that's just not the reality.